what really makes me feel sick, it's anger and sadness, is how in this kind of environment, when it comes to any type of supply, I mean, the PPE and all the other equipment and resources and medications, there, when you don't have a data-driven, centralized, organized approach to just to manufacturing, procurement, distribution, whatever it is, there's almost no opportunity for equity. And so there, it really is the squeaky wheel, the voices, and the people and institutions that are well connected and well resourced that are going to get supply. When you think about rural places or community health centers that are in more impoverished areas that at baseline are struggling to make ends meet, how do they enter a competitive bidding war over overpriced PPE? How do they have the political leverage to get doses of remdesivir when that's in very short supply and the process for getting it is so not transparent or equitable? So,
Well, I want to talk about equity, maybe from a little bit of a different perspective. You've also tweeted about your concerns about sexism and racism in medicine. You talked about sitting on tenure committees and how factors are determined as to whether one gets tenure or not. Is COVID-19 exacerbating sexism and racism in the medical community?
I think it is. I mean, on the one hand, if you it's all, nothing is new for sure. I think exacerbating is probably the right word. I think it makes it so much more obvious that it's happening. And it also shows very starkly to me what people's natural inclinations are. I mean, when you have to pull something together fast, you turn to what's available to you and what instinctively feels right. And it is clear that when we pull together these task forces, these committees, these panels, I mean, at every level in the institution, nationally, I've never seen so many manels, I think is the most visible manifestation of this. It's like, how is it that, panel after expert committee after,
Even now,
event,
even now on
right
COVID.
now for COVID, how is it that when you need to scramble and pull together, your A team, how is that always a bunch of white guys? And I'm not saying that there aren't,
Mhm. Smart
I,
white guys, but there's smart other people too.
yeah,
Yeah.
that's because it's a lot. Everyone has something to add, but we're not seeing everyone, I guess is my point. So it's not, it's not targeted against any one group. I'm just saying you don't have, when you don't have a variety of voices. I
And
mean,
you're speaking
clearly,
out on that. How do we fix it, Dr. Chu?
I think people need to, first of all, we cannot say this is something that we'll need to fix later. I mean, this pandemic issue, I mean, COVID is not going anywhere. And so we can't wait for this to be over. When is that? We're going to wait a couple of years until we've really gotten a vaccine out there. Then we can stop and talk about equity all over again. Like, it has to be a in the moment process. And I honestly think people have to make the commitment right now to say anything that I am a part of needs to be built, put together with equity. We will not get it in things that matter unless we get it in every little thing.